Somalia has received ventilators to help fight against coronavirus. The ventilators to treat COVID-19 patients are being supplied by the International Organization for Migration to help thousands of Somalis affected by the disease. The ventilators, donated by the federal government of Somalia and funded by the multi-donor Somalia Humanitarian Fund, will be used to set up an intensive care unit at the Di Martino Hospital, which is the main public hospital in the country's capital, designated by the country's Ministry of Health to treat COVID-19 cases. The donation comes against the backdrop of daily increases in the number of COVID-19 cases in Somalia. So far, over 1,976 people have tested positive and nearly 80 have died. The country has the second highest number of positive cases in East Africa and the Horn of Africa. The federal government of Somalia has put in place a health task force to fight the disease. The country also suspended all international and domestic flights and established isolation facilities to try and mitigate exposure to the infection when the first case was reported on March 16th. Somalia's health system infrastructure remains extremely fragile. There are only 9 ventilators in the hospital that will receive the donation, insufficient to face a major outbreak. With the SHF funding, multiple humanitarian agencies are also providing medical specialists and donating medical equipment such as personal protective equipment, including masks and gloves, to help the government's COVID-19 response. Due to the large population of internally displaced persons in Somalia, 2.6 million in displacement camps across the country, half of them in Mogadishu, the pandemic poses a substantial threat. The country has the total number of cases at 2,089 and the recovered patients are 380. The death toll stands at 79.